Yeah, shoot.
Sir, I'm
Brief history and positive findings and diagnosis. Yeah.
Okay, history. Give the history.
so she's 49-year female farmer by occupation, resident of Nanderi, Maharashtra. She came with complete. Sir, actually, she got operated on the left side 20 days back. I didn't got the opportunity to examine the left side.
Okay.
Okay.
You just tell us.
Yes.
The history, please.
Yes. She complains of pain and swelling since 4 years in both the ankles. Patient was apparently asymptomatic approximately 4 years back when she developed pain, dull aching pain in the both the ankle. The 49-year female. Yes. When he developed dull aching pain in both the ankles, which was gradually progressive in intensity and duration, which aggravates in frequencies. Which exaggerate on walking and movement of the ankle and relieves by rest and with medication. Pain is associated with swelling, which also gradually progressed over time. There is no history of any other joint involvement. Yes, sir. Yes, sir. Yes.
Then what happened? ऐसा होना चाहिए ना?
Yes, sir. She took on and off medication for her pain from the local doctor, and she got operated around 2 years back for the right ankle. When some fluid was taken and some tissue was also taken, but according to the patient, there was no test done for the sample.
No test.
Yes.
So what they took it for?
Patient doesn't. Then she again took on and off medication for her pain, and got operated for the left ankle 20 days back.
So right side, what happened then?
Sir, there is no relief in pain and
any other joint involvement. See, at the end of this, what are you keeping in mind? Any other joint involvement is there?
No, sir. There is no.
Is it traumatic? Is it inflammatory? Is it infective? No. Thinking of the etiology, could this be post-traumatic? Could this be inflammatory?
Yes, sir.
Could this be infective? What do you think?
Sir,
or could this be something congenital, sequel?
Sir, as per history, it can be of inflammatory origin. There is no history of significant
other
trauma,
joints are
but there is no history of morning stiffness and other joint involvement.
Okay.
Is the scar of operation where? Scar is there?
Sir, on the lateral aspect, just below the lateral malleolus.
Can you show?
Linear scar, sir, healed by family intention.
Scar, surgical scar.
What sort of incision is this?
Is it a surgical scar?
Okay. So you do not know what happened to the material biopsy, anything she has not told you, no?
Examination.
Has she told you anything? What happened to that surgery and the scar and the tissue?
Sir, she told me the wound was healed within 2 weeks, and she didn't know about the sample they took and any test.
Biopsy, vagare, no report, nothing she told you?
No, sir.
Okay.
She says nothing was done actually.
Okay. All right. Okay.
Do you have a slide on this? Clinical slide?
Okay. Now tell me local findings.
Sir, on examination, there is swelling on the anterolateral aspect of the ankle and on the posterolateral aspect of the ankle.
Donut shape? Is it horseshoe shape?
Donut means round. Horseshoe means that.
Medu vada shape. One is medu vada, one is horseshoe.
Medula and the other
Okay,
thing is what
doctor.
then?
Horseshoe.
The horseshoe is seen in which
Which
joint is
condition
affected?
Donut is in which condition?
Horseshoe means eaten medula.
Okay.
The lovers eat, no, you have a bite, then I have a bite. Miss?
Yes, doctor.
When you're deeply in love, you can do all this.
What about horseshoe shape? Which joint is affected?
Sir,
You have what are the joints there?
sir, ankle joint, subtalar joint, metatarsal
Okay.
joint.
So which joint synovitis or effusion would present
Horseshoe.
in a horseshoe manner, and which will present all around circumference, anterior and posterior.
Anyone from the audience would want to answer? Anyone from the audience?
Not all around.
Anterior and posterior is what? Ankle joint. No?
Ankle joint.
So that will be donut shape.
Donut.
And the horseshoe is only posterior. That is subtalar.
Subtalar.
Subtle.
Then
So it is.
is there any longitudinal swelling along the tendons behind the lateral malleolus, extending proximally and beyond the lateral malleolus,
Sir,
extending proximally and beyond the medial malleolus?
there is no, there is only a prominent tendon on the lateral side, but no swelling along the tendon on the.
Along the tendon. So tenosynovitis is not there. Then what are
But there
the?
is tenderness around.
No, before the tendon, we are inspecting.
Yes, sir. I am just.
Valgus.
Yeah.
Is she able to stand?
And,
She's not standing.
It's painful and she is not able.
Okay.
Sir, I'm telling you.
Huh.
On inspection, there is swelling on the both on anteromedial and anterolateral side, and on the posteromedial and the posterolateral side, and fullness on the fossa, both fossa on both sides of the tendinoachilles. And there is a prominent tendon on the posterior side of the lateral malleolus. There is a flat collapse of the medial arch, and there is a valgus deformity of the hip while inspecting from the posterior side, and there is a foot abduction with hallux valgus deformity while inspecting on the front side of the foot.
Hallux valgus, foot abduction.
And sir, while
Abduction at which joint? Foot abduction at which joint? What is the level of the abduction?
Sir, mid-tarsal. Sir, hallux
Mid-tarsal
valgus
joint.
at first
Mid-tarsal joints. What are these? How many mid-tarsal joints do we have in the foot?
Sir, there are two synovial joints, talonavicular and the calcaneocuboid joints. Sir, on palpation, there is a slight local raise of temperature and tenderness on the on all around the swelling and along the margins of the lateral and medial malleolus and along the posterior margin of the medial malleolus. And all inspectory findings were confirmed. Sir, there is a bony hard swelling on the posterolateral aspect of the ankle, lateral to the tendinoachilles,
We palpated
which is slightly mobile.
navicular. Is there an
Yes, sir,
bump
there is
there at the navicular
prominent
bone?
on prominence
How is the
of
tibialis posterior tendon?
there is tenderness behind the medial malleolus.
I'm asking at the where does tibialis posterior insert?
Sir, on the navicular. So there is tenderness around the tibialis posterior tendon behind the medial malleolus.
There is a tenderness.
Yes, but there is no swelling and
Where do we check for peroneal tendonitis?
peroneal tendinitis. So we'll check the tenderness along the peroneal tendons on the posterior aspect of the lateral malleolus and till the.
How many peroneal tendons are there?
Sir, there are actually 3 tendons.
Huh.
And
Very good.
2 in the lateral compartment.
And another one? Other one, third one?
Third one, tertius is in anterior compartment.
Okay,
on the
very
lateral
good.
side. Range. Sir, active, passive, dorsif.
Show me. What is the range of movement of the ankle? Show me how you test. Come this side.
Active.
Come this side so they can see. Show me, please.
Sir, active movement is around 15-degree dorsiflexion and 15-degree plantar
Now show
flexion.
me.
Sir,
You have told her, so then that's okay. Then
पंजा ऊपर नीचे हिलाना है आपको, ठीक है? पंजा हलाए ऐसे ऊपर नीचे.
so that is ankle.
Yes, sir. Ankle.
That is what she is doing. You don't know where she is doing.
Sir,
You want to do it passively.
Passively yourself. How will you do? Now she is doing that. That way she is doing this. Now show me the ankle movements.
sir, ankle movements are dorsiflexion and plantar flexion.
Do you want to eliminate some other joint movements to check for ankle?
What is distal to the ankle joint?
Hold very close to the ankle joint.
Yes. Sir, I'll hold a foot like this, restricting the movement at the midfoot.
What is midfoot joint? What are the joints of midfoot?
Sir, subtarsal joint.
अरे बाबा तू किधर जाता है? Sternoclavicular and calcaneocuboid, that is midfoot. That also has got dorsiflexion, plantar flexion, inversion and eversion. So therefore, where will you hold the foot for ankle?
Sir, I'll hold foot like this.
Then what will you move?
Then I'll do the dorsiflexion. And then the plantar flexion.
So where is it moving?
What about subtalar joint?
Sir,
You don't do that. You got good movement. Very good. But no. Now see, you hold this heel and you hold the ankle and see nothing is moving over there. It's totally ankle. Total wrong side. Whereas here, see, why is there a middle sword? What is moving?
metatarsal joint.
What is moving here? The movement. How you see? Not this way. Then you have the supination and
Supination position by the
there is difference between the midfoot and the ankle. So hold it and show ankle. Wait again. Hold the heel, hold the talus on the top. Left hand is talus. Now to dorsiflexion, plantar flexion. See, hold the heel. Hold it like this now.
Yes.
And do slight inversion to lock the subtalar joint, and then do
Yes, sir. By stopping the talus.
movement. Hardly any movement. As he said, as the donut swelling, that is the synovitis of the ankle.
Yes,
The
sir.
midfoot is free.
Yes, sir. Mid.
Have you understood what has happened over here? He said that it is a donut. That means the ankle is involved. Now, when you eliminate the mid-tarsal joint, the talonavicular and the calcaneocuboid, you find hardly there is movement in the ankle. So the ankle is involved. And the subtalar also, but not the midfoot.
No, the medial arch is collapsing. Sir, patient. Sir, we asked the first we asked the patient to do.
How do you test
stand on the-
tibialis posterior? Sorry. How do you test tibialis posterior? Can you show on this side?
Sir, tibialis.
Tibialis posterior tendon function.
Sir,
What is the function of
it's
tibialis posterior?
inversion of the foot.
So how do you test?
Sir, we asked we asked the patient to stand on both the feet. Both
Without
the,
standing, you cannot test.
so we can ask the patient to do inversion.
Sure. Which position? This position?
No, sir.
Yeah.
Sir, actually, we should ask the patient to sit on the edge of the table with the knee flexed 70 degrees. Then we
Do it, no? Just do it this way, no? Just put a figure of 4. Keep it on that side.
अजी ये पाव थोड़ा ऊपर रखने हैं दूसरे
Keep
पैर
it
के
on
ऊपर.
this.
Yes.
And now ask her to raise the foot.
अजी
Ask her to raise the foot.
पाव को नीचे.
You you tell her on this, you know.
Sir, she actually doesn't understand Hindi.
ये ऊपर करो, ये वरती करा. ये तिकडे खाली ठेवा. अच्छा. This swelling is here also, na, along. It is going proximal to the ankle joint or not?
Slightly.
We should be able to differentiate between ankle joint swelling and the tenosynovitis.
Yes.
What is the deformity of the foot here? Is tibialis posterior functional? Check,
No,
check,
sir. No, sir. Patient isn't able to.
Check. Is tibialis posterior functional?
अजीब पाव ये पंजा वर करा नहीं नहीं घुटना नहीं हिलाना है पंजा वर करा हाँ पंजा वर करा.
Now what will you see?
Yeah.
Where will you feel? Tibialis posterior.
Sorry.
Is it contracting?
No, sir. She is unable to do inversion actually. Sir. She is doing dorsiflexion.
Okay.
She is unable to do that.
So what is the deformity of the foot?
Sir, it's flat foot.
Flat foot. So what are the causes?
Sir, flat foot.
We check this now. Can that be a cause? We check this function. Can that be a
Yes,
cause?
sir. This can be posterior tibialis posterior tendon dysfunction can be a cause of adult flex.
Okay. Any other cause?
Uh,
Any other possible cause?
Does she have a flat foot?
yes, sir.
Flat foot is there.
Yes.
A flat foot right from beginning.
No, sir. She doesn't complain about the flat foot. Asking about the flat foot, she only tells about the swelling and pain.
What was she operated on the other side for?
Sir, for the same complaint. 20 days ago.
Okay, what you want to do?
Diagnosis?
Diagnosis.
Sir, in this 49-year female is having adult onset flat foot on the right side, most probably due to tibialis posterior tendon insufficiency with secondary arthritis and valgus deformity at the ankle joint and forefoot abduction. And she is unable to, she has difficulty in walking and
We
sweat.
check the sensations.
When you check the sensation on the sole,
Sensation, yes, sir, I checked, sir.
Sensation,
And sensation are normal, sir. Power also.
Is she diabetic?
No, sir. There is no comorbidity.
Are there any trophic changes in the skin or?
Sir, there are only callosities on the medial border of the foot. There is no trophic changes.
Okay.
Okay, read the X-ray at least. Sure. X-ray.
Sir, this,
see the X-ray first.
See the ankle epilateral. See the ankle epi. What it shows.
this one is.
So, see now. Tell us.
There is.
Right side.
Sir, this is anteroposterior and plain radiograph of anteroposterior and lateral view of the ankle joint, ankle with the lower part of the tibia and femur, and also showing tarsals and metatarsals. There is there is sclerotic changes on the plafond of the tibia and on the lateral malleolus, and there is sclerosis over the dome of the talus, and there is decreased joint space.
So that diagnosis is confirmed that the ankle is stiff. Whereas when you are asking her to do plantar flexion dorsal, you saying, "Arey wow, the ankle movements are good." So that is how you test for the ankle, as you did,
Yes.
as we showed.
Yes.
Agreed. So that confirms that the ankle is stiff because of osteoarthritic changes.
Secondary also.
Yes. Okay. Now, is there any bar? See if there is any talocalcaneal bar, talonavicular bar that
Yes,
could
sir.
have caused the flat foot and secondary changes in the plafond. No?
There is. Sir,
There is what?
There is ossification at the insertion of the tendon or Achilles.
It is presented so late. It is difficult, but possibly that is one of the possibility that there is a bar there in the childhood. Talocalcaneal fusion congenital bar,
Bar.
and now there are secondary arthritic changes
The
in the ankle and
Yes.
So now what
Is
would
it
you
not?
do?
So you can confirm by what? By which radiology method further? If you have
Further
to
investigation,
confirm
would you like to
bar,
confirm by further investigation?
Sir, for the bar,
how will you confirm by what?
Which further investigation would you like to do?
sir, I don't know about the bar.
You would
CT
like to do
scan,
CT scan.
CT scan, coronal section or CT scan.
These usually present much earlier, no? But she has come now in the adulthood, but they present by the 17, 18, they should present.
But chief complaint is pain in the ankle.
Pain and swelling in my ankle. Yes.
So what will you do now? What would you? What will you offer to the patient?
Uh,
You will evaluate further by getting a
MR.
show the investigation next. दाखव ना फिर. Investigation दिखा.
So the MRI is of the other leg.
Okay.
So what will you? MRI is not available for this side.
Yes, sir.
What will you offer treatment wise?
As there is severe arthritis and the deformity at the ankle joint, and also severe pain on walking, and patient is unable to do her daily activity, we can offer her for the immobile painless joint
Yes.
and surgical intervention.
You are talking of an arthrodesis.
Yes.
How will you
corrective
know?
was-
First of all, how will you know whether that ankle arthrodesis is going to be curative for her? Can you do some test or procedure beforehand?
Mm. Uh,
Suppose you inject a local anesthetic into the ankle
yes, sir.
under fluoroscopic control,
Yes.
and that relieves her pain temporarily. What does that tell you?
Pain was originating from the joint.
Originating from the joint and
Yes,
no
that is
soft
one.
tissue.
Is one. And second is you cast that in particular position in which you are planning to orthotize and see if the patient gets relief. So
Yes.
she will know that this is the position in which you want to orthotize. What is the position of choice?
Uh,
This is on the opposite side. Opposite side. This was a picture.
Okay, so which joint, Dr. Pangate's question, which joint you want to fuse?
um, sir, sir, there is involvement of both tailor ankle
This
and
is on the
subtalar.
opposite side. This side, this thing. This is on the operated side that they have done it. But it's a similar pathology. So we have put it. It's not the right side.
So, there is involvement of both ankle and subtalar joint. So
The subtalar joint is already fused, right?
yes, sir.
So,
But sir, it is painful.
okay. So you want to incorporate both the joints in your fusion process.
Yes.
What is that called?
Pantalar.
Pantalar.
arthrodesis.
Pantalar orthodosis.
Yes.
What are the ways to do it? How do you achieve that surgically?
Sir, sir, it can be done in one or two stages. First, we fuse the subtalar and the metatarsal joint.
Using what? How do you do it? What is the implant?
Sir, we put a corticocancellous screw from the calcaneal tuberosity, spanning the calcaneo subtalar joint. Or sir, we can do intramedullary nailing from the plantar aspect of the foot.
Through the calcaneum transtalar into the ankle, right? Nail.
Yes.
Right? After fashioning the cartilage. Yeah. What is the position of fusion?
Sir, 5 degree of plantar flexion and around 5 degree of abduction at the mid foot.
Okay. Thank you.
Oh, I take a leave. Thank you very